I started to review integrative and naturopathic alternatives. I found that there were exceedingly few in the United States. They were either incredibly expensive or what they offered I knew was not going to be enough for me at the stage my cancer was in. So my partner joined me in my search for something that we felt would work, and he came across Navigator, which was something of a miracle because neither of us had known anything about it at all. And up it popped, and I thought, let's give it a try. And I'm so glad I did.
Facing a cancer diagnosis can feel like navigating uncharted waters. You're searching for answers, for hope, for time. Welcome to the Heal Navigator podcast, where we explore integrative and alternative cancer treatments and therapies from around the world. We're here to provide you with the options, insight, and the hope you need now.
Hi, Maggie, and hi, all that are tuning in today. Maggie, I'll just hand it over to you. You can give a brief introduction of who you are, how you were brought here today.
Okay, my name is Maggie Lyons. I am a patient at the San Diego Clinic in Tijuana, Mexico, under the guidance of Dr. Fito Munoz. In 2016, I was diagnosed with cancer in my right breast, and a lumpectomy was advised, and at that time I agreed to it, and nothing else went wrong. Everything was fine. I refused radiation and chemo, and we went for another year, when then I was diagnosed with a carcinoma in situ in exactly the same place. Again, I was advised to have it out, which I wouldn't do now because I know a great deal more about carcinomas in situ. But I had it out, and a keloid scar began to form because I'd had surgery in that place twice. Okay, everything went fine until 2022, when I was diagnosed again, but this time, apparently, I had a very aggressive cancer tumor growing almost on the chest wall of the right breast. So I was advised to have a mastectomy. Again, I agreed to do this. And again, I refused chemo and radiation because I've been following a naturopathic path for many years now. My surgeon insisted that I had a PET scan because she was absolutely sure I had metastasis. I had one and it showed no metastasis at that time. That was September 2024. 18 months later, what I thought were keloid scars developing on the mastectomy site turned out from a biopsy to be cancer tumors. And now I was diagnosed with very late stage 4 metastatic breast cancer. A little later on, an oncologist told me it was spreading to the lungs and the bones. Because I didn't want to do conventional oncology at all, I started to review integrative and naturopathic alternatives. I found that there were exceedingly few in the United States. They were either incredibly expensive or what they offered I knew was not going to be enough for me at the stage my cancer was in. So my partner joined me in my search for something that we felt would work, and he came across Navigator, which was something of a miracle because neither of us had known anything about it at all. And up it popped, and I thought, let's give it a try. And I'm so glad I did. Peyton, you gave me a choice of 2 clinics. So when I got Dr. Munoz's initial protocol, I thought, wow, this is really for me, because there was a huge emphasis on repairing the immune system. And this is something that conventional medicine completely ignores. I could go on about conventional medicine's disadvantages, but to me, it's utterly incredible what conventional medicine doesn't look at all. And it's not surprising that most people get their cancer back. But anyway, Dr. Munoz is a trained immunologist, and that appealed to me exceedingly, and was at the clinic for 5 weeks, 5 days a week of IV transfusions and vaccines. And I got there, he took blood tests because he's more than ready to completely make your protocol unique. And that meant knowing exactly what was going on. And he modified my protocol according to the results of the blood work. So that was the first thing that impressed me greatly about this entire system. It's uniquely for you. It's not a one-size-fits-all by any means. It's very thorough. In fact, for me, it was quite heavy going because I've had gut issues for years. And this was a huge amount of medication for me to take. And I'll tell you a little later on, there were disadvantages for me in taking so much medication. But it went on for 5 weeks, 5 days a week, 4 days of what he calls metabolic therapies, all IV infusions, and vaccines, and 1 day of very low dose chemo. But the metabolic therapy was all about repairing the immune system, and it included things like polypeptides and folic acid and vitamin C and vitamin K and all of these nutrients that a fully functioning immune system needs. After 5 weeks, I was to go home and self-administer another 8 weeks of IVs and vaccines. I was given 2 weeks of training on how to self-administer IVs because I'd never done anything like that in my life before. I had no clue. And it was at first quite complicated and thorough. You have to know what you're doing when you administer your own IVs. Anyway, I went home with an enormous suitcase full of medication crammed into it. I did find that it was heavy going, and there were times when I actually stopped doing them for a week or so. I couldn't keep up with all of it. It was, there were 3 days of this, 2 days of the metabolic and 1 of the low-dose chemo. Even though it's low dose, it will have an effect on the body. You can feel it. I was extremely tired and weak after it.
Now, in comparison to standard of care, not to interrupt you, do you feel like the low-dose chemo is drastically different? People, when they hear low-dose chemo, they get very timid about it. They say, oh, will I be vomiting the whole time? Am I going to lose all my hair? Will I have a completely eradicated immune system? Did you find this to be true, or was it more ease with that?
You get so much focus on building up your immune system that I never felt mine was compromised by the chemo. Now, I did lose most of my hair. It doesn't come out all at once as I believe it does with conventional heavy dose chemo. It comes out slowly, but it comes out nevertheless. And I also got anemia, which I'm been treating for, which will come with chemo. So it definitely has its side effects. But I should mention that before I was doing this treatment from the clinic, I was getting high-dose vitamin C and mistletoe IVs from an integrative nurse practitioner's clinic. And I already had a port installed for that, which made life a lot easier than having to have needles stuck in my veins. So that made life a lot easier. And they also helped to keep the port clean, which was a relief for me. I didn't have to do that myself, nor did I have to put what's called a Huber needle in, because the drip line you don't put the drip line straight into your body. There's a needle that goes into the drip line and then goes into you. And that has to be kept clean and taken out every 3 days, which is what they did at the clinic. Had I not had that nurse practitioner's clinic to help me with that, I would have had to do all that myself. It's one of the disadvantages of doing your own administrative therapy.
They're the only clinic, though, that will send you home with IVs. No other will do it.
Well, that doesn't surprise me in the least. I'm very glad you mentioned that, because that's what I noticed when I was doing my reviews of other clinics in Tijuana. Nobody seemed to be interested in what happened to you when you got home, or at least you weren't doing the same treatment that you were doing at the clinic, which meant IVs.
Right.
Very intense treatment. But again, as I said at the beginning, I never felt that the low-dose chemo was in any way, I think it was highly successful, and it did not destroy my immune system by any means, because of that enormous focus on helping your immune system to be as boosted as possible while you're going through all this. So yes, I'm free of low-dose chemo now. The other thing my clinic did for me, which unless you know of an integrative clinic that can help you locally when you get home, I don't know how you're going to get this kind of help. You won't get it from conventional treatment. But the clinic every 6 weeks does a blood test known as the North Star blood test. And what it does is measure the number of circulating methylated cancer cells in your body. Within 3 months, I had gone down from 92,000 of these circulating cancer cells in my body. Most healthy people have less than 10,000, I'll add. I had gone down from 92,000 to 400. The remission point is 25. The next blood test will be at the end of March, and I am expecting to be at remission by then, if not a lot sooner. I already feel I've got there, but I won't get the other test right away, so we've got to wait for that. And Dr. Munoz in Tijuana is most interested in getting the results of that test. The other thing that I really like about that treatment is he doesn't stop at remission, by the way. He works with you for another 5 years. He says, I want to get you to the point where you have a minimal risk of ever getting cancer again. So now I have finished the at-home treatments. I still have a few treatments at the clinic locally that I go to for a nutritional vitamin mineral.
And what treatments are those that you're getting at that local clinic?
It's high-dose vitamin C. As a matter of fact,
You're going to continue that.
Yeah, it's a higher dose than Dr. Munoz was giving me, and mistletoe. It's very
okay. So you are continuing those.
I am continuing that slowly. I take a break every now and then from that, but yes, I have continued with that. Probably will off and on until we get the results of the next North Star blood test. As far as the treatment goes, yes, it's heavy duty. It's very intense, but it works. And to me, it works amazingly. I mean, 92,000 of these things circulating in my bloodstream, and we went down to 400 in 3 months. To me, that shows it. Something's working, and I'm pretty sure it was the San Diego clinic's protocol.
I think a lot, as we touched base on, is that at-home protocol. I tell people, because everyone's like, ooh, IVs, I don't know if I can give that to myself. I'm like, well, he can utilize your port if you have it, or he'll install a PICC line. So you're not completely accessing yourself every single time, but it is in depth. And so that's why a lot of times he will encourage people to have a loved one go with them to the facility. And that way they're kind of assisting whenever they get home. But I really believe, because you're doing, 7 bags of IVs 3 times a week. I mean, it's a lot of treatment that usually a lot of people are doing when they return home. I was going to ask how heavy your suitcase was when you returned, because in the very beginning, I didn't know to tell people to bring an additional suitcase as well, because a lot of times people aren't expecting to go home with that much equipment. But all that entails really helps the body keep up with, as you said, as what's going on at the facility, because they send you home with supplementation, nutraceuticals, maybe dendritic, and then dietary recommendations. But a lot of people also don't realize that you do have to return back to these facilities. So that was something I was going to get you to touch on too, is helping to lay this expectation for our listeners, maybe explaining what Dr. Munoz expects of you in regards to your return visits to the facility.
He wants to see those North Star blood results. But yes, I am supposed to go back. He will do a checkup, and at that point we will discuss the next stage in my treatments. All of that makes a huge amount of sense. You can't just leave the clinic and never go back. I don't understand that at all.
Yeah, I think a lot of people think it's a silver bullet, because, and also the financial aspect that comes into play.
Well, that's considerable.
Yeah.
And one of the reasons I never even considered a European clinic, and they do exist, of course, as you know, in Germany and I believe Belgium, I knew it would be vastly more expensive than what was on offer in Mexico. And even what was on offer in Mexico was way beyond my budget. But when you're in a bit of a tight corner, you find ways to get the money.
Yeah. Yeah, especially, I guess, now seeing the results that you do, you feel confident that you did take that leap of faith.
I'm very glad. Yes, of course I went into debt, but I'm very glad I did, because the protocol works. My life is saved. The oncologist I saw only at the insistence of my partner. He just wanted me to see one, but I knew what all the answers were going to be. My partner asked him how long I had to live if I did nothing, and the oncologist said she's got 6 months. Well, I saw what the oncologist was going to do with conventional medicine, he wasn't going to do 99% of what we did at this clinic. It was totally inadequate. And there was absolutely no discussion of repairing the immune system or nutrition or what diet I should be, or even lifestyle changes. There was nothing like that.
I hear this often, actually, and like we've touched base on the fact that these clinics do offer chemo, or if someone's hormone positive, sometimes hormone blockers might be recommended for a short-term basis. So it never has to be one way or another, but usually alternative medicine is seeing the whole body aspect. And as you said, most importantly, repairing the immune system, which I want to talk on because the people that are listening in, they keep hearing the word vaccines, which might turn off some people. Can we dive into what these vaccines are, how Dr. Munoz created them, like what was expected of you? Did he explain that process when you were in clinic?
He did not. We didn't discuss a lot of it because I think right at the beginning I explained to him that I'd been doing organic food and being very careful about my diet for many, many years and my lifestyle. So that's probably why we didn't go into a lot of that at all.
Yeah, I can touch base on it. So the vaccines that Maggie got are known as autologous therapies. So what that is, it's an umbrella term for dendritic cell, natural killer cell, LAK cell therapy. This process is created by using the person's blood, urine, or sometimes tumor biopsy. So this process actually enhances the immune system by creating those good cells that naturally occur in our body, such as the dendritic cells, natural killer cells, and LAK cells. So these are your soldiers. They go and they attack the cancer. So by ramping up the immune system and creating more of this, it actually supports your body overall. So this is actually what Dr. Munoz specializes in. He has his own lab that creates these specific therapies. And this is like the highlight of his treatment protocols. And so as Maggie touched in the beginning, he's immunologist. These treatments cannot be obtained in the United States. So people often are commenting, can I get these here in the States? Or can I get these in XYZ country? Most countries have very tight regulations on utilizing the dendritic or natural killer cell therapies. You can't get them. They're actually just now starting to go through clinical trials here in the United States. They are trying to get them approved to where it can be used through mainstream. Most commonly, you'll hear of CAR T cell, but you have to meet very rigorous guidelines to be accepted as a patient to even utilize that. So most people worldwide will travel to Mexico, as Mexico has been practicing utilizing these methods for decades now. So it's kind of like most facilities are going to use at least the dendritic. It's the most common one people hear of, but there are some other cell line therapies. So I just kind of wanted to highlight and touch base on that to provide that information, because we do know the V word, the vaccine word, is a little bit of a, or when it comes to people, they kind of stop in the term. So it's not what you think in regards to the regular pharmaceutical vaccines. So I just wanted to also highlight some things that, were disadvantages or things that you wish that you would have known about in regards to cost in Tijuana, cost of the program, what the facility was like, and what Mexico was like.
Yes, while I was there for 5 weeks, each week cost $7,800. And put that together, that was $39,000 right there. My enormous suitcase full of medications, which I had to take back with me. You can't just expect them to go through customs and everything else on their own. You've got to be with them. If you want to use them immediately, you're going to have to do that. That cost $18,000 for those medications. Mm-hmm. Now, the clinic does not offer accommodation and it doesn't offer meals. So again, you have to find your own accommodation and meals. They will help you with that, but that's another out-of-pocket expense. And there are some small expenses when you get back, and you have to do your own treatments. You've got to get antiseptics. You've got to get some sort of bandage which doesn't stick to sensitive skin. You've got to get a pole for the IV and so on. So there are definitely those sorts of expenses. Fortunately, I did not have to get a taxi. I was on the Pacific coast, 5 miles outside downtown Tijuana. So I was staying in a motel there, and fortunately, they have a driver who turned up every day. So we saved some money there. But yes, it's not cheap. But yes, it's a great deal less than you might pay in Europe.
What were your thoughts before you went to Mexico versus what your thoughts are now? Did you ever have any concerns about going to Tijuana specifically?
No, but I loved the protocol. I loved the sound of Dr. Munoz. He and his patients were doing all right, so why shouldn't I? No, Tijuana isn't my favorite Mexican city, but I will say this. I love Mexico and I love Mexicans. They're full of fun. They were so upbeat. The staff was wonderful, very caring, very professional, very thorough.
People just are concerned always of safety. Like I hear all kinds of like really in-depth concerns. I was like, I was 32
Yeah.
weeks when I went pregnant.
Yeah.
So yeah, I mean, I wouldn't go if I felt unsafe, but it's good to hear from patients though, what their
Yes.
perspective are.
I never had any qualms about that. The clinic itself is in a pretty safe part of downtown Tijuana. And where I was staying out on the West Coast is also considered relatively or comparatively safe. And people were friendly and things were right around the corner from the motel. So yeah, the only disadvantage for me there is that a lot of the Mexican food was it was full of grains and tortilla this and tortilla that and jalapeno this and habanero that, and I don't eat that kind of food. So I began to lose a lot of weight there because I simply don't cope with it very well.
Reach out to me next time. There's a place called Alma Verde. It's like an organic eatery in the Cacho area.
Great. That's what I was kind of looking for.
The reason why Dr. Munoz doesn't provide meals, it's a very small facility. It's like a doctor's office facility versus these bigger institutes where they have kitchens and stuff. There's just not room for it. But I will say Tijuana does. There are some organic eateries, organic market type things. I'll help you next time. That way you don't lose weight because we need to keep your weight up.
Yeah, help would be good.
Is there any like advice or insights that you'd like to offer to those that are facing similar cancer journeys?
The at-home treatments, I will say this, I am so fortunate to have an integrative clinic near me that can help me keep the port clean. And with advice, sometimes drip feed wasn't working right. It wasn't flowing right. They gave me tips on all of that. I got some at the clinic in Tijuana, but I also got some from my local clinic and it really helped. And I also think you do need a partner who's willing to help you. I don't know what I'd do without Robert. He's been so wonderful, taking up lots of things because you can get very weak.
Yeah.
And then you find you can't even do very simple, normal things. You're just too tired. So to have someone around who can help out when you need it, or if you don't have a husband or partner living at home with you, then, a good friend, try and get a good friend involved. Because even if you feel strong enough before you get the treatments, I can guarantee you're going to have some really weak feeling moments as the treatments go on.
You just need a safe place. I think everyone needs that. Someone to lean on, someone to provide that support for you while you're at your most vulnerable state.
Yep.
Yeah. Did you find any like books or resources that you found beneficial during your research, just in general, to learn about alternative methods or anything that you found eye-opening?
I have to say that I have, over the past 3 years, developed a very strong spiritual approach to life, and that has got me through immensely. I can't say enough about that because I didn't want to. Well, maybe that would be good for another time because it's rather a complex approach. You have to change your mindset considerably.
I'm spiritual myself. As you just said, mindset is everything.
It is. And you need to keep positive in any way you can. And a spiritual approach to life will help you do that.
I always tell people, just in life in general, not even just in cancer, but the mindset of that life is not happening to you, it's happening for you. And
Exactly.
if we can view things in this perspective, we fall out of that victim mindset. And it opens us to so much more awareness of the different connections that are all around us. And this is so important in regards to healing. And I love the fact that you brought that up. It really warms my heart because I think that this perspective needs to be highlighted more.
No, it definitely should be. Emotional issues are also incredibly important.
Yes.
So it covers all of these aspects of life and emotional blockages and all this sort of thing.
Yeah. So just like to kind of touch base on emotional, what was your biggest fear in regards to choosing alternative clinics or taking this leap of faith of going to a facility rather than standard of care? Because you're so set on not doing standard of care, but did you ever have any hidden emotions about taken this path and this big jump?
No, because I knew I wasn't going to go the conventional route. So there was no question. It would be what some people call alternative. I call integrative.
Right.
In Dr. Munoz's case, it is integrative, either that or naturopathic, but I think they're probably all integrative to some degree. So no, I never had any doubts about that. My partner did insist that I saw a conventional oncologist, as I mentioned before, but again, I wasn't surprised at anything he said, and I found these visits to him quite depressing, and I never got depressed by the San Diego clinic because it was always so upbeat.
They're very positive there.
Yes.
And with it being such a small clinic, it's very family. I mean, Dr. Munoz has his family actually working for him, very family oriented, but you're an extension of that family while you're at the clinic.
Absolutely. It's a good way to put it.
So we're coming to the end of this podcast episode. Maggie, is there anything else that is on your heart that you wish to share today?
Yeah, good question. No, I think we've covered most points, if not completely, then certainly we've covered them, and your listeners can go on to do their own research. But I do definitely recommend this clinic. There's no question in my mind that, and the one thing I will tell you, which I didn't mention before, is that Dr. Munoz does not accept patients he doesn't think he can treat.
Thank you.
And he's actually turned some patients away. He said they were too far gone and there was nothing he could do to help them. And he was, frankly, really honest with them. But even though I had late stage 4 metastatic cancer, he still said, I can really help you.
Yeah, thank you for highlighting that. He is very transparent. I just had somebody that was denied. I hate to say turned away, but denied last week. And there's always options for those that are, depending on the diagnosis, things like that. But he's limited with, again, the setting he has, because it's not like a full-fledged hospital that some clinics might, to have that 24-hour observation, because you do stay outpatient. When you hear stage 4 standard of care, they highlight in your mind that you're terminal. That's it. You're done. You have 6 months to live if you don't do anything, and then you go to alternative or integrative practices, and it's like, hey, look at me now, buddy.
Exactly. Yeah.
So thank you for touching on that.
Thanks for joining another episode of the Heal Navigator podcast. Remember, you're not alone. At Heal Navigator, we're dedicated to empowering you with the knowledge and resources to navigate cancer care. If you'd like to learn more about integrative cancer clinics, explore the alternative treatments we offer, or speak with one of our experienced patient care advocates, please visit our website. We'll drop the links in the show notes below. Until next time, take care and keep exploring your options.